We have Dr. Cedrek McFadden with us. He's our 7 News medical consultant. We wanted to talk a little bit about pancreatic cancer in light of the tragic death of Alex Trebek, the longtime Jeopardy host. So many people, Dr. C, have been really impacted by him over the years, and also the example and the brave way he led his fight with pancreatic cancer. But one of the things it has done is really raise a lot of awareness about this particular form of cancer, and a lot of people have questions about, well, how do I know? I think Alex Trebek was known for talking about how he missed some symptoms he wasn't aware of. So, what are the warning signs when it comes to pancreatic cancer?
One of the challenging parts of pancreatic cancer is that there are often warning signs that are missed. There are not many of these warning signs for pancreatic cancer, first of all. And many of the cancer or many of these signs are fairly non-specific. That means that it can be seen in other things other than pancreatic cancer. So we're referring to having sort of abdominal discomfort that may radiate or go toward the back. Again, there are a lot of things that can create that same sort of sign, but it is one of the early warning signs. And there could also be not being able or not wanting to eat as much or having weight loss. More advanced signs of pancreatic cancer can extend to include yellowing of the eyes or the skin or jaundice, as you may see disease that either spreads to the liver or blocks the bile duct that's draining bile from the liver. But again, not a lot of early warning signs for pancreatic cancer.
And when it comes to detecting it, I mean, is this something that shows up in blood? I mean, how do they figure out if you've got it?
Well, for colon cancer, we have colonoscopy. For breast cancer, we have mammography. We don't have the same sort of screening test for pancreatic cancer. You may see on routine blood work elevated liver function test that can tell you whether or not there's primary or whether or not there's involvement of the liver or whether there's a blockage to the ducts that drain bile from the liver. You may also see, if pancreatic cancer is suspected, an elevated blood test called a CA19-9. It's a tumor-associated protein that can be elevated in people with pancreatic cancer. But again, ongoing research is going right now at a lot of centers that will look at some more specific blood tests that can indicate whether or not early pancreatic cancer is present.
So, who needs to pay the most attention? Who is the most at risk for this?
Well, fortunately, pancreatic cancer is still one of the more rare cancers. About 3% of the cancers, about 1 in 64 lifetime average risk of getting pancreatic cancer. But again, it's generally seen in people who are older. 90% of the cases are diagnosed in people over the age of 55. Men are more likely to be diagnosed than women. Blacks have higher risk, as well as certain heritage groups such as Ashkenazi Jews. People who smoke have 2 to 3 times increased risk of having pancreatic cancer, diabetics, and people who are obese. And those are things that obviously we can control. Family history is one that we can't control, but only 10% of people who have a family history will be developing pancreatic cancer. So again, those are some of those risks, but just because you have a risk factor doesn't mean that you will or that you won't get pancreatic cancer.
And when it comes to the real cost of this disease, like in Alex Trebek's case, it took his life. People hear about a celebrity like that, and then they sort of associate that's a deadly cancer, and sort of assume it is a death sentence. Is it?
Well, part of that stigma comes from the fact that there are not a lot of warning signs. And again, many of those early warning signs may be confused with other things. I mean, if you're having back pain, there's a whole litany of things that you can confuse or kind of attribute that back pain to. So if we can find this cancer, like most of these cancers, early, that's a better chance of actually being cured. But not to have complete despair, pancreatic cancer is certainly in certain stages can be treated. Surgery is not what it used to be 10 or 20 years ago. Neither is all chemotherapy or treatments with radiation. And so that is one of the pieces that we try to advocate on, is recognizing signs and symptoms, bringing them to your doctor's attention, and seeking help. And if you need surgery, again, it's not perhaps what you may have heard from 20 or 30 years ago. Some people are concerned that, once they open me up, they're going to find that, the air has caused the cancer to spread, and that's not the case. And so that's still a modality that's useful, along with chemotherapy and even some radiation treatment. So talk with your doctor about signs or symptoms that you could be having, and really bring them to their attention as soon as you have them.
Dr. C, thank you.
Thank you.
Coming up on Carolina's Family at 4, a scam to warn you about. See how those scammers are using social media.